All right. Can you introduce yourself for the tape?
Yeah. My name is Natalie Foster. I am president of Economic Security Project, and I believe that everyone in the richest nation on earth deserves an economic floor.
And can you share a little bit about what you mean by an economic floor? Especially on this podcast, we talk a lot about the juxtaposition between economic policy and health. And what are the implications on that front when you think about an economic guarantee or an economic floor?
Yeah. Well, by that I mean that there should be a floor through which no one can fall, a baseline of support people have, a guarantee of housing, of healthcare. We take on the guarantee of income, the idea that everyone should have cash that comes monthly. That supports the agency and dignity to live, life on your own terms, and that we know how to do that in this country. And if we decided it was important, we could make it happen tomorrow. So we know that cash isn't a silver bullet, right? We have broken markets. There are all kinds of structural reforms that are needed to really create the economy that works for everyone. But cash is an important tool that supports people in moments of crisis. And so that's what I mean by an economic floor and a guaranteed income.
And can you talk to us a little bit about cash as a health intervention?
Yeah, well, inspired honestly by you and a number of other physicians and healthcare providers, it became really clear to us that doctors and nurses see a number of poverty related issues in people, in their patients when they come into their clinics, but there's nothing they can do, right? They can just write a prescription for medicine. But the real prescription needed is to fight poverty. And so we wanted to dig into that connection between health and economic security. And so did a bunch of interviews with physicians, doulas, healthcare providers, nurses to understand what they are seeing and experiencing. And people spoke loud and clear that we have the solutions like direct cash. We just need to have the political will to make them happen.
And I think we saw, to your point, like I'm a former health commissioner as well, folks well know. And, you sort of think about like a car without shocks. And when it's driving along, it hits a bump, what happens? And if you don't have shocks, the car rattles. It might break an axle. Or everybody's head hits the roof. Whereas when you have some shocks, right, you can weather the load a little bit more. And too often the experience of poverty is about shocks. It's about how much absorption can you take when life hits you with a bump. And I think, we don't appreciate the impact that that has, not just on people's economic well-being, but when the rubber hits the road, specifically around health. And there's the health impact of not having those shock absorbers, that extra bit of money in the pocket to support you. But it's also the fact that like too often health and disease can themselves be the bump in the road. And I think these things kind of interact in some big ways. And one place where we saw that happen in a big way was the pandemic. Can you talk a little bit about the pandemic era and the impact that it had on the conversation about cash and cash as a key resource for health?
Yeah. In the pandemic, it was a extraordinary economic crisis alongside a health crisis. And government decided we have to do something to support families and reached for ideas that were lying around and had been tested and tried and true. And one of the ideas was giving people monthly cash through a guaranteed income. And it had been tried in Stockton, California, and Jackson, Mississippi, and a number of other places to great success. And so the lawmakers picked this idea up, they moved it forward in the form of the expanded child tax credit, in the form of expanding the earned income tax credit and stimulus checks. And people, for a short period of time, felt the experience of having a floor that every month those checks came in, whether they lost their job due to the pandemic or whether they got a promotion at work, the checks came. They knew they could count on that bit of economic security. And it had a very meaningful impact on people. We know just the expanded child tax credit alone cut child poverty in half. We know that people were able to access healthier foods during that period. They went to the doctor more often. There were all kinds of health outcomes that come from having the ability to have a bit more breathing room in your financial life. So, unfortunately, that has been rolled back federally. But the good news is we have a blueprint. We know how to do it. So if we can build the political will to get there, then the blueprint is there and can be turned on within weeks.
And what did we learn about the impact, right? I know there was a lot of effort to study the experience of the pandemic. What did we learn about the ways that people used that cash? And then also want to sort of get into more of the literature about what we've been learning about these experiences in cash. But what did we learn during the pandemic specifically?
We learned that people felt more agency over their own lives. So for example, I talked to a mom who every year her kid goes out for soccer, and it's very stressful for her because he's outgrown his soccer kit each year, and she has to get a new one, and that's not in the budget. And the year she got the child tax credit check, was able to go to the store and get what the kid needed to start soccer. She felt tremendous amount of relief around that financial stress, and her kid was set up for success. It was that kind of simple story that we heard over and over and over again, that sit alongside the stories of people eating 3 meals a day instead of 2 meals a day, right? Because they were able to afford to do so. And so I think it's the agency that is really important. We also know people were less stressed. We know that financial stress is the biggest stressor today in people's lives. And during the pandemic, there were many, many stressors happening. But one thing could be relieved when those checks came in the door. And so people felt a bit less stressed.
And can you talk a little bit about, there have been a couple of different studies now that have come out looking specifically around the impact of cash on health, particularly among the well-being of kids. Can you talk a little bit about what the literature is showing us specifically? I know there's some studies that have been a little bit less conclusive and or supportive, and then there are studies from abroad that have been incredibly supportive of cash as a health intervention. Can you walk us through some of that literature?
Yeah, we wanted to dig in specifically to the period of time in an early family's life. So the pregnancy, the birth of the child, and the first few years of a child's life. That is a very expensive and vulnerable, exciting moment in people's lives. And so I'm just going to talk a little bit about that period of time, because the literature there is really profound. One thing we know is that during that period, earnings go down because the mom is not able sometimes to work as easily in the last 2 months of pregnancy and in the first few months of pregnancy. So you have a period of life that's vulnerable and then financially vulnerable, yet costs skyrocket, right? Babies are expensive, even babies where there's no difficult, pregnancy involved. They're still incredibly expensive, and so you have a real mismatch in people's lives. And so we know that cash supports families, in that moment. We know that it improves pregnancy and birth outcomes. It helps people with medical, care, nutrition, safe housing. They're able to spend the money in the way that they know best and in the way that they need. And so conditions are linked to better birth outcomes. Dr. Zaya Malawa in San Francisco is doing a study looking at cash transfers and the racial disparities in maternal health, specifically with Black moms and AAPI moms, and is finding that cash transfers have a significant impact on easing those racial disparities, right? So we know that it's important during the pregnancy. But the second thing we found is that it supports mental health in the patients, right, in the parents themselves, but also in the healthcare providers. And I'd love for you to speak to that in your own experience, the experience of having patients come in who are experiencing difficulty due to just not having the money needed to buy the diapers to have the electricity on in their house. The things that so many people take for granted is really stressful for providers. And so we saw that it supported mental health among both patients and providers. We also saw that it allowed people to follow up on care more thoroughly. In Atlanta, for example, 43% of the mothers who are part of the cash transfer program, right, the guaranteed income program called In Her Hands in Atlanta, were able to go to the doctor on a regular basis and take on appointments that they had been putting off due to cost after they were enrolled in the program. So those are just a few of the things that we saw across studies in this country and from interviews with providers.
Yeah, I don't see patients day to day, but I know that in my experience of operating FQHCs and public health departments, that it's a lot harder to take care of folks when A, they see a lot of these bumps in the road, and B, they don't have shocks. And so much of what a doctor does every day is to offer advice and counsel and then direct folks to things like, interventions that may cost money, things like medication and or surgery. And what happens is when you've got patients who have very, very long problem lists and you cannot deal with all those problems. Plus, each of those problem lists both is exacerbated by foundational poverty, and folks don't necessarily have the means to be able to get the kinds of services that they need. It can be extremely frustrating, and it leads to this well-worn syndrome that we call moral injury. This idea that if you know that something is wrong and broken and you are trying to fix it and you cannot do it, that at some point there is this reflexive response, which is almost a numbing to what you see in front of you, which I think afflicts a lot of clinicians in our healthcare system. And I think if you can address that foundational challenge that too many people have by making sure that they have the resources to get the care they need and or to prevent the outcomes that you are trying to work with them to prevent, it changes their experience.